Look, if someone suddenly starts having severe chest pain, a heavy or burning feeling in the chest, shortness of breath, cold sweating, or dizziness, don't ignore it. This could be a heart attack. Let me explain in a simple way what you should do at that moment. First of all, don't panic. Pick up your phone and call emergency services immediately. Do not let the person drive themselves to the hospital. Their condition can get worse on the way. Now, help the person sit in a comfortable position. Slightly sitting upright is better than lying flat. Loosen any tight clothing around the neck or chest so they can breathe easily. If you have aspirin and the person is not allergic, give them one aspirin tablet to chew. Aspirin helps thin the blood and can slow down clot formation. Try to keep the person calm. Tell them to take slow, deep breaths. Reassure them that help is on the way. If the person suddenly becomes unconscious, check if they are breathing. If they are not breathing, start CPR immediately. Give 30 chest compressions, then 2 rescue breaths. Continue until emergency help arrives. There are some things you should never do. Do not give food or water. Do not give alcohol or home remedies. Do not make the person walk. Remember, in a heart attack, every minute matters. The right action at the right time can save a life. If this information helped you, share it with others. And for more life-saving health tips, make sure to subscribe.